Welcome back to the Deep Dive. Today we're getting into something really important, something that affects so many people on a very personal level, in vitro fertilization. Specifically, we're looking at sport and IVF. When you're caught up in all the medical stuff, the appointments, the hormones, figuring out exercise can feel, well, confusing. So our mission today is a deep dive into how you can manage physical activity safely during IVF. It's about using movement for your mental health, right? Without messing with the treatment itself.
Exactly. And I think what's really key to grasp up front is that exercise during IVF isn't about, hitting personal best. It's much more about the psychological side. This whole process is incredibly stressful, and the research is pretty clear. Moderate supportive movement is a fantastic way to manage that stress.
Okay, so less about performance, more about just
Yeah.
coping, managing.
Precisely. It's about managing the emotional roller coaster. Exercise releases endorphins, those feel-good chemicals, we all know that. But maybe more importantly, it helps lower stress hormones like cortisol. And high cortisol isn't great when you're trying to conceive.
Right, can interfere with things.
It potentially can, yes. Plus, think about it. Your life suddenly revolves around clinic visits, waiting for results, having a simple exercise routine, something gentle you control. That gives you a sense of normalcy, a bit of routine back. It can genuinely help take the edge off the anxiety, maybe quiet down those thoughts that just go round and round in your head.
That sense of control must be huge. Okay, so it's not a one-size-fits-all prescription, is it? The advice changes quite a bit depending on where you are in the IVF cycle.
Oh, absolutely. It shifts dramatically. Let's break it down phase by phase. We
Yeah.
can start with the preparation phase. So this is before the ovarian stimulation drugs kick in.
Right, before things get really intense. What's the general idea here?
This is generally the most flexible time. Moderate activity is usually encouraged. Think maybe 30 minutes most days of the week. The goal here is supporting your body, good circulation, healthy weight, sort of setting the stage hormonally.
And when we say moderate, what kind of activities are we actually talking about? Because moderate, for someone who, say, used to run marathons, might be very different.
That's a great point. We need to redefine moderate in this context. It's not about pushing your limits. Think supportive, lower impact movement. So walking is fantastic. Gentle yoga, but probably avoid the really hot, sweaty kinds for now. Light strength training, maybe with resistance bands or light weights. Swimming is good too. Pilates or bar, if done moderately.
Okay, gentle and steady. What's the big no-no then, even in this early phase? Why dial back the intensity?
The main concern is really about hormonal balance. Really intense or excessive exercise, we're talking long-distance running, heavy lifting, hours in that kind of thing might actually mess with the hormones like estrogen and progesterone. It could potentially affect how your ovaries respond later. So we want beneficial movement, not extreme stress on the body.
Got it. Support, not strain. And what about partners? Does this apply to them too?
Yes, definitely. It's relevant for sperm health as well. Moderate activity seems to be beneficial for sperm count, motility, the works. Extreme overtraining, though, not so much. So it's actually a good time for both partners to maybe find a gentle routine together.
Okay, that makes sense. So that's phase one, the prep. But phase two, ovarian stimulation. You said this is where things get really delicate. Why the big shifting caution?
Right. This is where the physical landscape changes dramatically. The stimulation medications are designed to make multiple follicles grow in your ovaries. This means the ovaries get much larger than normal. We're talking significantly enlarged sometimes. Well, reports say they can get as big as oranges, maybe even small grapefruits in some cases.
Wow, grapefruit-sized ovaries. That sounds unstable.
It is. They become heavier, they're kind of suspended by ligaments, and this enlargement creates a very real risk of something called ovarian torsion.
Torsion. That's when the ovary twists on itself.
Exactly. It twists on its own blood supply, it cuts off the blood flow, and that is a serious medical emergency. It's rare, thankfully, but the risk is heightened during this phase because of the size and weight of the ovaries.
Okay, that completely changes the game for exercise.
Yeah.
So torsion risk means certain activities are absolutely off the table now.
Absolutely off the table. Anything high impact or jarring. So no running, no jumping, no intense aerobics classes. Also avoid heavy weightlifting. And critically, anything that puts a lot of pressure on your abdomen. Think crunches, deep twisting movements, even some intense yoga poses. Vigorous dancing, probably not a good idea either.
Even cycling. I wouldn't have thought of that one.
Well, the risk of falling is the main concern there. You just want to minimize any chance of sudden impact or abdominal trauma.
Right, minimize all risks.
Yeah.
So if all that is out, what can people safely do? Because the need for movement for stress relief doesn't just disappear.
No, it doesn't. And gentle movement can still be really beneficial. We're talking light to moderate intensity now. Think maybe 50% to 70% of what felt normal before IVF. Gentle walking is really your best friend here. Prenatal or restorative yoga can be wonderful. Lots of focus on breathing, relaxation. Just make sure to skip inversions or anything that feels like it's straining the belly.
So keep it really low-key.
Very low-key. Light swimming might be okay, like gentle laps, not going all out. The key is listening to your body. You should be able to hold a conversation easily. If you feel tired, bloated, heavy, just stop. Rest is more important.
Interesting, though. You mentioned bloating. Does light movement actually help with the side effects from the stimulation meds?
It can, actually. That's a good point. The drugs often cause bloating, some fluid retention, maybe even constipation. Gentle movement like walking helps with circulation, lymphatic drainage. It can help move that fluid along and ease some of the discomfort.
So it's not just mental, there's a physical comfort aspect too. But always listening to your body first.
Always. That's the golden rule throughout this whole phase.
Okay, that's the stimulation phase covered. Now we get to phase 3. The procedures themselves, egg retrieval, embryo transfer, and that waiting period. Let's tackle egg retrieval first. What happens right after?
Egg retrieval is a medical procedure, even if minor. So expect to need some rest. Generally, 24 to 48 hours of taking it really easy is standard advice.
Just rest, no movement at all.
Pretty much rest initially, but then gentle walking is usually encouraged fairly soon after, maybe the next day or so. It's actually important for preventing blood clots, but definitely avoid anything strenuous, no heavy lifting, like nothing over maybe 10 or 15 pounds. And stay out of pools or baths for about a week usually, because there's a small risk of infection.
Right, okay. Rest, then gentle walking, avoid water and lifting. Got it. Then comes the embryo transfer and the infamous TWW.
Ah, yes, the TWW, a time of high anxiety for many.
And there used to be this idea of complete bed rest, right? Just lie down for 2 weeks, and that's still recommended?
No, not really. The thinking has shifted significantly on that. Most clinics now advise against strict bed rest. There's actually no good evidence that it improves success rates, and frankly, it can increase stress and anxiety. Plus, some worry it might even slightly hinder blood flow to the uterus. So gentle movement is generally preferred.
Okay, so no bed rest prison, but you still need to be careful, obviously. What needs to be avoided during these crucial 1 to 2 weeks?
Similar rules to the stimulation phase, really, but maybe even more gentle. Definitely avoid high-impact activities, no running, jumping, intense cardio, no heavy lifting or exercises that really engage the core strongly. And a really important one here, avoid anything that significantly raises your core body temperature.
Like hot yoga again, or saunas.
Exactly. Hot yoga, saunas, hot tubs, even very strenuous exercise in hot weather. The idea is to keep the internal environment stable and optimal for implantation.
Why is overheating such a concern right then?
There's some thought that excessive heat during this very early stage could potentially interfere with the embryo's development or its ability to properly implant in the uterine lining. It's about creating the best possible conditions.
So the focus is on supportive, gentle activities that maybe help with blood flow without causing any strain.
You've got it. Think really calm movement. Short, relaxed walks are perfect, maybe 10, 20, 30 minutes. Gentle stretching feels good. Breathing exercises can be incredibly helpful for managing the stress of the wait. It's all about support, calm, and just being kind to your body during this really hopeful but anxious time.
Being kind to your body. That sounds like a good mantra. Okay, before we finish up, we absolutely have to cover the warning signs. When do you need to stop exercising immediately and call the doctor?
Yes, this is critical information. Your body will give you signals if something isn't right or if you're overdoing it. You need to stop activity and contact your clinic right away if you experience any sharp or persistent pelvic pain or cramping. Any heavy bleeding or spotting that seems unusual. Also, dizziness, feeling really short of breath, nausea during or after light activity, and importantly, sudden or severe bloating or abdominal swelling. That last one could be a sign of OHSS, ovarian hyperstimulation syndrome.
OHSS, that's when the ovaries have overreacted to the meds, right?
Correct. They become very swollen and fluid can leak into the abdomen. It needs medical attention. So any of those symptoms, stop, rest, and call your fertility team. Don't wait.
And keep track of how you're feeling generally, right? Like fatigue, discomfort.
Absolutely. Keep your clinic informed about how you're feeling throughout the process, not just if there's an emergency. Communication is key.
Okay, so wrapping this all up, if we had to give one core takeaway from this deep dive.
I'd say it's that IVF requires a shift in mindset about exercise. You need to scale back the intensity significantly. Prioritize gentle, mindful movement mainly for stress management and supporting your body. It's about finding a balance between movement and rest. And crucially, always listening to your body's signals over any preset plan.
Listen to your body. Great advice.
And of course, we have to state this very clearly. Everything we've discussed today is purely for informational and educational purposes. It is absolutely not a substitute for professional medical advice. You must always consult your own fertility specialist or doctor before you start, stop, or change any exercise routine during IVF treatment. They know your specific situation.
Absolutely. Essential disclaimer. Thank you. And if you are looking for more comprehensive information about the entire IVF process itself, there's a great online portal with lots of resources. It's called IVF for Me. That's IVF for Me. You can find a wealth of information there. Thank you so much for joining us on the Deep Dive today. Keep learning, stay well informed, and take good care.